Hi there, I'm Dirk Schrader, and I'd like to summarize the findings from our recent cybersecurity research for you. We've likely all had one: an X-ray, a CT or MRI, or an ultrasound exam. They help doctors to find medical issues and define treatments for diseases like COVID-19, cancer, and tumors. Clinics and hospitals collect a vast amount of data about their patients, including all kinds of personal information, a description of findings, and medical images generated during exams. All this is stored on a system called PACS, a medical archiving system which in the US is protected by HIPAA. Its privacy rule requires healthcare providers to have safeguards in place that ensure the confidentiality, integrity, and availability of electronic personal health information. Unfortunately, we recently discovered sensitive medical data that can be found on hundreds of computers connected to the public internet without any kind of safeguards in place or any coding or hacking necessary. Using only free tools, we have access to over 14 million exams belonging to 3.5 million US citizens, including hundreds of millions of images related to these exams. Information about sensitive and critical medical conditions, names, social security numbers, date of birth, exam date, and all this spanning over 25 years. These systems don't even apply the very basic security measures most of us use on our PCs or laptops. There is no password, no username. They are connected to the internet and easy to find. And the data is there in clear format, unencrypted. So much for confidentiality, right? Even worse, some systems allow the download and upload of files, meaning false information can be added or important images can be altered or deleted, potentially delaying life-saving treatments. Here is the loss of integrity. As PACS are part of a medical process, cybercriminals can assume that once they have uploaded a malicious file, the malware is likely to spread internally within the hospital's network. Once that foothold is established, a ransomware attack can be deployed, and gone is the availability. In the final days of October 2020, the Cybersecurity and Infrastructure Security Agency, CISA, the FBI, and the AHS issued an advisory about an imminent ransomware attack on nearly 400 US healthcare organizations. Considering we've found over 180 unprotected medical archives, riddled with more than 3,000 medium and critical grade vulnerabilities, it seems all too easy for attackers to find their victims. We've even found initial indicators of compromise. To learn more about this research, or to find out how to employ and embed basic controls and protections for this kind of exposure, contact us at NNT. Thank you.